So guys, welcome to this video. I'm really excited to be talking over here, and I want to thank you guys for taking the time out to come here and watch this video. So we're going to be speaking about autism pathophysiology and the USMLE tie-ins. So we have over here autism in the USMLE first aid book, which is like which is like the standard. We have maybe like 7 points I want to mention. Okay, it's first is going to be autism spectrum disorder. Next is going to be early onset in childhood. Then we can have social and communication deficits. Then we can have some repetitive ritualized behaviors, restricted interest. And then we're going to be having this point of intellectual disabilities or above average abilities from music and common in males, and they're going to be increased head and brain size. So we can see there's like probably like, I would say 9 points. Spectrum disorder, that is a spectrum, occurs in childhood. Social communication defects, repetitive and ritualized behaviors, restricted interests, intellectual disability, above average ability for specific skills, common in males, and associated with head or brain size. So we can see there's 9 key points. Okay. So first of all, I want to be speaking about is going to be coming to the first slide. Sorry, that's going to be spectrum. Why is it called spectrum? Okay. The spectrum is because it's a range of symptoms, severity, and ability. So range of symptoms. So some people struggle with language and daily living skills. Others, they will have a high verbal and are independent. The range of severity. So from very mild difficulties that are only show up in complex social settings and range of abilities. So some people have intellectual abilities, disabilities, and they have average abilities. Some have exceptional or savant like Terrence. So I looked at an image. I found an image from online. So that can be they can have problems with executive function. They can have problems with sensory processing. They can have problems with repetitive behaviors. They can have problems with motor skills. They can have preservative speaking, thinking. They can have social awareness and verbal and non-verbal communications. So the next point is going to be it occurs early in childhood. So why does autism occur early in childhood? Many of the genes linked to autism affect how the brain grows and it connects with the fetal life. And the first years after birth, the brain development is rapid in infancy and childhood. The first 2 years, 2 to 3 years of life, there's explosive brain growth. There's neurons, synapses, and neural networks at very high rates. So that's a really key reason that over here the genes linked to autism also are affect how the brain grows. As you know, first 2 years, it's just the brain is growing at a really fast rate. Okay, next. So we spoke about spectrum early on in childhood. Now we have to speak about social and communication defects, repetitive ritualized behaviors, and restrictive interests. So that's gonna be the next thing. Okay. So we can see social and communicative deficits. So we can see the brain circuits for cognition. So you can see a social brain network involving the amygdala, superior temporal sulcus, and the prefrontal cortex and fusiform gyrus. And this is going to be differentiately in autism. And we can see the face and eye processing. We can see less automatic recognition of facial expressions and social cues. And we can see repetitive and ritualized behaviors. We can see neurological imbalance and excitatory inhibitory signals in the brain and repetitive motor pattern emerge. We can see restrictive interest. We can see enhanced perceptual and memory systems, easier to notice fine details and patience and patterns. Why do we have intellectual disability or above average ability of the specific skills? So autism affects atypical neural growth. So affects how the brain region connects and communicates. Some pathways may be underconnected, leading to a difficulty in complex reasoning, social understanding, or flexible thinking. Many other pathways may be overconnected, so highly specialized and exceptional skills. So essentially, we're here. It's either there are going to be some topics that are going to be you're going to be overly connected, or you're going to have underconnections. Some parts are going to be really highly connected or overconnected. So we can see challenges with social skills, challenges with communications, and restricted or repetitive behaviors. Okay, now let's come over here to the we can see over here autism, and we can speak about a little bit of the common in males, and we can see a increase in head and or brain size. So we can see the most autism risk genes are carried on X chromosomes. Since the males with only one X chromosome mutation, there is going to be a stronger effect than in females who have 2x as a backup. There's going to be increase in a head or brain size. Possible mechanism is due to excess neuronal proliferation, reduced pruning. In autism, there may be too many neurons connections, and this leads to increased amount of size over here. All right, guys, wanted to do a USMLE question for the previous autism video that we covered. So, a 6-year-old boy with autism spectrum disorder has difficulty with communication, social interaction. Which of the following interventions may be shown to be most effective in improving functioning in such children? A is antipsychotics, B is behavioral therapy, C is psychodynamic psychotherapy, D is parent-child separation, E is electroconvulsive therapy. So what do you guys think is the right answer? So the correct answer is going to be behavioral therapy. What's going on over here? So, of course, we all made it very clear that the most effective intervention in early intensive behavior education therapy is applied behavioral analysis. So, as we know that this will help the autism children learn as we studied in the previous slide that autism you essentially have a deficit of your social communication, restrictive, repetitive, ritualized behaviors. Over here, this will allow them to learn communication, early skills, and this is going to allow them to have self-care skills. This will improve cognition and language development and works best when stated early before a school age. So then we can see over here the antipsychotic medications is risperidone, aripiprazole, useful for anyone with severe irritability, aggression, or self-injury. And it they do not have do not treat the core social communication deficits. We can see psychodynamic therapy, so we can see this is going to be insight therapy. This is not effective in autism spectrum disorder. This is because the core problem is not unconscious conflict, but deficits in social communication. Then we can have parent-child separation. So this is going to be outdated. This is harmful. It's not really used. Electroconvulsive therapy is that you kind of shock them, and that's going to be for treatment resistant or treatment or catatonia, because essentially this shock will kind of fluctuate the serotonin, and that will kind of really help over here. All right. So that's going to be autism, and I look forward to you guys in the next video.